Factor IX Rec, FC Fusion Protn Solution, Reconstituted, Recon Soln, is a medication used to prevent or control bleeding in people with hemophilia B, also known as Christmas disease. It is specifically for those who have little or no Factor IX, which is a protein in the blood that helps the blood clot and stop bleeding. This medication is important for people who are at risk for prolonged bleeding after an injury or surgery, or for sudden bleeding in the joints or muscles without an obvious cause. It's important to note that this medication should not be used for other types of factor deficiencies or problems, to reverse the effects of blood thinners, or to treat bleeding from low levels of liver-dependent clotting factors due to liver problems. The daily dosage and optimal timing for taking this medication should be determined by a healthcare professional. Before you start using Factor IX, be sure to read the patient information leaflet if it's available from your pharmacist. It's important to follow your doctor's instructions for the dosage and how to inject the medication into your vein. The dosage will depend on your medical condition, weight, and response to treatment. If you'll be giving yourself the medication at home, make sure to learn all the preparation and usage instructions from your healthcare professional. Before using the medication, always check it for particles or discoloration. If you see either of these, do not use the liquid. It's also important to learn how to store and discard the medical supplies safely. Remember, the medication in the vial and the supplies that come with the medication should only be used once and should not be reused. Some brands may require you to limit the amount of blood entering the tubing and to avoid letting any blood enter the syringe. If this happens, consult your pharmacist for details on what to do. And as always, if your condition lasts or gets worse, be sure to tell your doctor. Some common side effects of Factor IX Rec, FC Fusion Protn Solution, Reconstituted, Recon Soln, include fever, pain at the injection site, chills, headache, flushing, weakness, nausea, or vomiting. If any of these effects persist or worsen, contact your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, you should inform your doctor immediately if you experience any serious side effects, such as swelling at the injection site, shortness of breath, fast heartbeat, signs of kidney problems, swelling of the ankles or feet, pain, redness or swelling of the arms or legs, or new or increased bleeding/bruising. If you experience very serious side effects, such as bluish fingers, chest pain, or trouble breathing, seek medical help right away. While a serious allergic reaction to this drug is rare, it's important to seek medical help if you notice any symptoms of a serious allergic reaction, such as rash, itching or swelling, severe dizziness, or trouble breathing. This is not an exhaustive list of potential side effects, so if you notice any other effects, contact your doctor or pharmacist. In the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before starting Factor IX, make sure to inform your doctor if you have any allergies to Factor IX products or other substances. This medication may contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your pharmacist. Also, be sure to tell your doctor about your medical history, especially if you have other clotting disorders, have recently had surgery or have liver disease. If you are planning to have surgery, it's important to let your doctor and dentist know about all the medications and products you are using. If you are pregnant, Factor IX should only be used if clearly needed. It's important to talk to your doctor about the risks and benefits of using this medication during pregnancy. If you are breastfeeding, it's unknown if this medication passes into breast milk, so consult your doctor before continuing to breastfeed while using Factor IX. It's important to be aware of potential drug interactions that could affect how your medications work or increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. And remember, do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Factor IX Rec, FC Fusion Protn Solution, Reconstituted, Recon Soln, include drugs that help with clotting, such as aminocaproic acid and tranexamic acid. Always consult with your healthcare provider before taking any new medications. If someone has taken too much of Factor 9 Rec, FC Fusion Protn Solution and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's crucial to act quickly in these situations to ensure the best possible outcome. It's important not to share this medication with others. Your doctor may also recommend lab or medical tests to monitor your Factor 9 activity while using this medication. Be sure to keep all of your medical and lab appointments. If you have any questions or concerns, consult your doctor for more details. Be sure to take each dose of this medication as directed. If you happen to miss a dose, consult your doctor or pharmacist immediately to determine a new dosing schedule. Do not take a double dose to make up for a missed one. Be sure to follow the storage instructions provided with the product and ask your pharmacist if you have any questions. Keep all medications out of reach of children and pets. Do not dispose of the medication in the toilet or drain unless instructed to do so. When the product expires or is no longer needed, make sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.